Penn Wissahickon Hospice is
amazingly supportive,
guiding,
passionate,
love,
amazingly compassionate,
hope, extraordinary.
Hospice is end-of-life care, but end-of-life care in a very full sense.
When there are no further treatments that can make an illness better, the focus of treatment shifts to comfort and shifts to taking care of people in the best way we can.
We really try and wrap our arms around the patient and the family to be with them and support them as their loved one and our patient goes through physical changes, emotional changes, psychological changes.
Penn Wissahickon Hospice is different from other hospices in that we have a beautiful inpatient unit in Rittenhouse Square. There is a lovely kitchen area where families can come in and prepare a meal or gather together. We celebrate patients' lives by understanding what it is that is important to the patient. Asking them, simple question, how can we help? What's important to you? What do you envision for the next 6 weeks, 3 months, 6 months, whatever time frame is important to them.
They went along with our plan. We always wanted my mom to be at home, surrounded by loved ones, and Penn made that possible. She got the same care she would have had she been inpatient somewhere, but she was at home, comfortable in her own bed, surrounded by family all the time. And so, I mean, what more could you ask for, really? It was perfect.
We have counselors and social workers dedicated to bereavement support specifically, and that includes for adults and children.
Penn Hospice had a wonderful program for kids. It was Camp Erin, and it's a weekend camp for kids who have lost a loved one.
When we first got there, we make pictures of our loved ones, and then Saturday we play kickball and all these sports and activities, and then we make luminary bags, and that night we have a luminary ceremony and acting and singing and a big party, and then Sunday is when we have we all come together and we just say our goodbyes.
The hospice itself was wonderful, but it was actually through the music therapist, Molly Hicks, that she was just incredible.
It was very effortless in terms of them kind of training me to give the kind of care that was needed. And then, of course, when I came in-house, it was 24/7, and I didn't have to worry about any tactical health providing things to do. I could just be a supportive, husband. What the Wissahickon Hospice team does is support them in achieving their goals. It's not about death. It's about living. It's about living every moment to the fullest.
So why give to Penn Wissahickon Hospice? Because we're not able to do all the things we can do or want to do with the money we receive from the insurances that pay for people's care.
There is a gap in that funding, and in order for us to provide our innovative care, such as the music therapy, the art therapy, the grief programs, the Camp Erins, the Grief Reach, the legacy projects that we do, we need support to continue to do that.
Donations are so important because it's going straight to the hands of the people that need it, and those people are, working miracles every day.
This experience and Penn Wissahickon Hospice offerings touched me so deeply, and I just felt that was where I should be able to give some money.
It really was the best decision we ever made for my mom, and we wish we had made it sooner because, she really got the best care available.